MRI. And I want to introduce you to a new treatment method for prostate cancer. It's MRI-guided, high-intensity focused ultrasound treatment of the prostate. You know ultrasound as a diagnostic tool, but you can also use ultrasound as a therapeutic tool when you focus the ultrasound beam in a certain area of tissue and ablate the tissue there. We will perform our experiments on a 3D Philips scanner, which is equipped with a 16-channel pelvic coil. The pelvic coil will be wrapped around the pelvic, and we acquire then different imaging planes and acquire also temperature maps of the prostate during the treatment of HIFU. You can see here the example how we will perform the HIFU. It's a transurethral transducer that is placed in the urethra here, and then we have some heating patterns due to the ultrasound that is focused in a certain area of the prostate and will ablate the tissue there. We have then an MRI control, so here's the MRI scanner, the patient lays in the scanner, and then you can see here the prostate. You can define now an area that will be treated with the HIFU treatment, and then we have a backfeed loop, so we have here the temperature maps that goes back in the MRI scanner, and then the treatment procedure continues in areas that haven't been treated before. For our imaging, we will use canines in the first step, because canines in human males are the only beings that commonly suffer from prostate disease. And the canines are also large enough to fit in our scanner and our coil, and can also be used for the treatment with the transurethral catheter. We will use 15 male beagle dogs in this IUCAT approved protocol at the University of Chicago. And we will use MRI guidance because MRI offers the best soft tissue contrast of all imaging modalities, and it also allows us to use temperature control. And these functional techniques, there are diffusion techniques and perfusion techniques. I don't want to go in detail, but you can use MRI for different techniques and help to get better results. I want to show you some of our preliminary results. This is the prostate of a male beagle. Here's the placement of the catheter, and you can see nicely how the catheter delineates from the surrounding prostate tissue. And we acquired also with collaborators from the NIH temperature maps here, and Philips Medical System was also involved to do this mapping of the prostate. So these are temperature maps that shows you where the tissue was heated to a certain temperature degree. And then you can describe so-called dose images to see where the treatment was successful at the end, and that helps you to better understand how the treatment worked out. In the future, of course, we want to translate this project into humans then. Therefore, I was also in the protocol development workshop from Dr. Schielski, which was very helpful. So we will apply for this then in the IRB, and we also got just federal funding from NCI to continue the study, which is very great. Okay.
Thank you.